Right. I am Dr. Avas and today we are going to discuss another case in the pulmonary medicine. As we will continue our medical series, pulmonary series. So today we will discuss another classic case. So before diagnosing, I am going to give you history of a patient and then you can diagnose or you can spot abnormality in this CT chest. First of all, I am going to give you history. So this is a city of a 25-year-old male. He was a non-smoker and he presented to us in an emergency with several episodes of hemoptysis. And when we did his city, we found mass on his city. So can you guess diagnosis? Yes. So this patient is having a mass over here. You can see this one. I am pointing, I am encircling with my pointer. This is mass. This is aorta and this is mass. This is central endobronchial mass. Right? So this is carcinoid tumor. Alright? This is bronchial carcinoid tumor. This is classic. So whenever you see a patient comes to you with hemoptysis and he is non-smoker and when you do his CT, you find a mass, central endobronchial mass and enhancing lesion, hypervascular lesion. For example, lesion there is much more blood supply. You can suspect that that patient is having a bronchial carcinoid tumor. Alright? Bronchial carcinoid tumor is basically a neuroendocrine malignancy which is derived from bronchial epithelium. It mostly, arise from the bronchial, proximal bronchial, and it result in blockage of secretion, and patient may have wheezing over there. So, right. So this is a case which I have presented to you. This is bronchial carcinoid tumor. If a patient comes to you, with a less age and he is non-smoker, and you find a mass on his CT which is enhanced, you should suspect that the patient is having a bronchial carcinoid tumor. Right? So whenever you see a patient who comes in emergency with several episodes of hemoptysis and he is non-smoker and you suspect a mass on his CT chest, you should suspect a patient is having a bronchial carcinoid tumor. One of the hallmark I am going to give you that will give you a surety that this patient is having a bronchial carcinoid tumor, and that hallmark is enhanced, you can say, a hypervascular lesion which will be seen on the CT. That will give you an idea that this patient is having a bronchial carcinoid tumor. Hopefully you can know whenever you see a correlate clinical finding with CT chest, you will able to diagnose this case very easily. Right? So this is another case today we have discussed, and next time we will discuss another case that will be classic emergency case in the next series.